Hi everyone, thank you for coming. Thank you George for the introduction. I'm Vanessa Taylor, and today I want to talk about food. Many of you in the room know that food is my passion. For my couple years here at the Masters of Development Practice program, I've examined food-related issues everywhere from Nepal to parts of South America, parts of Europe, and back here to California. So the reason I decided to focus on local issues is because I really have noticed that change starts here at home. And I was very excited about this project that I was very, very inspired to join because there's actual momentum taking place. It's something that is real and it's happening. So a brief reason why food-related topics are so important for development. Food touches everything. Food is fundamental. It's the heart of some of the biggest problems that we face. Just a few examples: energy in the United States. Food, the growing, processing, and distribution of food consumes about 20% of the fossil fuel that we use in the United States. It's a fifth of the energy. Healthcare, 75% of healthcare in the United States goes to treat preventable chronic illnesses, most are related to diet. So that's almost $500 billion that goes towards what people call symptoms of a lousy diet. And climate change, or climate, the numbers are around 20 to 30% of greenhouse gases are estimated to be produced by linkages to the food system. So the food system wasn't always this way. This is a dramatic change that's taken place in the last just couple of generations. So with that, the industrial food system that now dominates the United States food production system is associated with a host of issues, including air and water pollution, toxic chemical exposures, antibiotic-resistant bacteria, soil erosion, climate change from greenhouse gas emissions, and loss of biodiversity. These negative impacts on public health and the environment have incited many agricultural experts to insist that the U.S. food system is currently in a crisis. This is a deeply rooted systemic challenge, and many, especially in this area, have promoted different ways that we as individuals can change our purchasing habits. But the issue with this is that not everyone has the means to make these changes. Not everyone has the resources to change their food purchasing habits. So what I was interested in looking at is how to make sustainable options readily available for everyone, regardless of their socioeconomic status. So on an individual level, consumers do not hold much sway with large corporations that dominate agribusiness. However, as collective entities, institutions, anchor institutions in our community, especially universities, schools, hospitals, could use their economic purchasing power to move the marketplace towards healthier and more sustainable practices throughout the food system. So this project proposes that by purchasing foods that are produced, processed, and transported in ways that are protective of both public and environmental health, institutions can make a profound difference in the food system and in their own food environments. The aim of this project, in order to measure this, was to quantify the collective demand for sustainably produced food products at a subset of key California education and healthcare institutions. And I worked on this project in collaboration with an organization called Healthcare Without Harm. And the work that we're doing is going towards a larger collaboration that they have implemented this year. And that is in conjunction with the Real Food Challenge and School Food Focus. And it's a movement to ensure healthy, sustainable food systems for all through these sustainable purchasing practices. My methodology for this project was a combination of various things, including document analysis, quantitative and qualitative research methods. And the primary question that I wanted to get at by measuring these different factors was, what is the volume of demand for sustainably produced food that currently exists, and what is the potential of the combined purchasing power of multiple institutional sectors? Quick note on terminology: sustainable. I know that many in this room have some hesitation when using a word like sustainable, and I just wanted to point out that for the purposes of this study, there's a strong alignment between the different organizations involved around how we're defining sustainably produced food, and it's a very broad, encompassing definition that includes minimal harm to the environment, healthy for consumers and producers, and fair in terms of wages and working conditions for farmers and farm workers, respectful of animal welfare, and supportive of the economic well-being and sustainability of communities, both rural and urban. I wanted to go into some of the challenges of each institution that I surveyed and some of the findings. In the interest of time, I'll keep this quite brief, but some of the general challenges that the K-12 district have, but school districts have, but also these apply to all the other sectors as well, were generally around reliable supply, food safety, adequate volume, quality, seasonality of fruits and vegetables, and the number one factor through all sectors that I looked at was cost. So at the K-12 school districts, one of the things that also stood out is that there's other barriers involved and other factors that have to be considered. As this quote shows, this is Alex Emmett, our school supervisor at Oakland Unified School District. They're responsible for feeding an entire generation of urban school children, so that is a huge factor that needs to be taken into consideration. And many would argue that schools are a place of equality in our country. It's a place where everyone should have access to fair and sustainable food. And there's a host of other factors that constrain school districts. It's much too complicated for this, but in my study I go into things like federal reimbursement and commodity entitlement dollars. Those are all factors that come into play with school districts. At the University of California campuses, the second sector that I looked at to get at the university piece, there are similar constraints, but in some ways there's a little bit more flexibility with purchasing. But in many cases, I just concluded that it's much more complicated, which is why I picked this quote by Sean Penn, executive director here at Cal Dining. It's essentially just needing to understand all the different players involved. And briefly, with hospitals, the hospital sector represents an area of great potential growth and leadership for many reasons. Healthcare Without Harm is leading in this sector in terms of recognizing the point of connectivity between health and the environment. So we have time for the results. I'll jump to those. I just put up a few main numbers. So these are representative of 21 different facilities that I looked at. These are the aggregated numbers that I came up with for the 2013 to the 2014 year. So what I wanted to demonstrate with this was that there is enormous purchasing power at these institutions. This is understandably a very comprehensive, or a very overview examination of what's there. This is by no means comprehensive. But the point of this was to give a baseline assessment and just show that there is this purchasing power. And more importantly, through these conversations with everyone involved, it became apparent that people are interested in switching to more sustainable practices. So these recommendations are just the high-level ones I went into, but overall, the point of this was to show that institutions such as schools, universities, and hospitals could become alternative economic engines. They can actually move the marketplace through their purchasing power. They would automatically provide a political and social support system for these type of changes in the food system. So with that, I want to thank you all for coming, and especially for my two members of Healthcare Without Harm who are in the audience, Felicia and Kendra. Thank you very much. Questions?
We don't have enough water in California. Is California food always sustainable?
Is California food always sustainable? It's an excellent question. Part of what we looked at in the study is that local versus organic might be something that we have to consider, that sometimes an apple that is flown in from farther away might be, in fact, more sustainable than something that is coming from California. So the simple answer to that is no, in my opinion, and from some of the people I've spoken with in the study. But in general, the idea is that in California, local is preferable to something that is flown in from far away, because if you look at the overall cost over the course of the lifetime of that product from start to finish, it actually ends up being less environmental impact and less cost for the institution. But it's complicated, essentially.
Did you look at any existing relationship between these institutions and an agricultural or food organisation, and how the balance of that played out?
Between an agricultural or food organization? What do you mean by that?
Say, what's the big agricultural food organisation in Monsanto? So are there existing relationships between agricultural entities and these institutions? If there are, how are they playing out so far?
Right. I'm not sure about Monsanto specifically, but certainly there's an entire network of procurement and distribution involved, and existing relationships and agreements that are in place, and that's something that has to be taken into consideration. It's a huge barrier in some cases, and it certainly varies sector by sector. I don't know if that answers your question. Okay. Any others?
So I know that there are a lot of urban gardens in Oakland, and organizations like People's Grocery who work to provide sustainably farm food to youth in Oakland. So does the Oakland Unified School District, how does it interact with the local urban gardens?
The Oakland Unified School District interacts with a number of community partners, and it is involved with California Thursdays program is something they're promoting, which is through the Farm to School program. In terms of urban gardens, I don't know explicitly, it was not an area that I looked at, but with some of the hospitals, such as Washington Hospital and Fremont, they are implementing their own garden in the hospital sector. So there's a lot of movement around trying to increase those linkages. That was one of the main points of this study.
You know, it's an interesting public health implication, because if you're getting food from a lot of different areas, you're averaging out things like selenium, molybdenum, which in patches may be either too high or too low. And one of the arguments about going to Safeway is where they're getting food from all over the world, you're getting an average of these compounds, where if you're locally growing them, you're going to get just a chance concentration. Do you have any comments on that? It's not would not be considered sustainable, but public health wise.
Right. I hate to give such broad answers, but I feel like the only way I could answer that is that some of the different measures that we looked at, you do have to look at how it balances out. So I agree with you that in some cases it might be a matter of balancing something that comes from far away and something that comes from closer, as Louise was asking about. And there are measurements in place through the Real Food Challenge. They actually have a calculator of how they measure some of those factors. But it is a burgeoning field, and they're trying to evaluate that. So by no means am I endorsing local as the only way to go. That was not the point of this. It was to show all the factors involved. One more question?
Another question about eating locally. What if grains are a large percentage of your calorie intake, which they have to be, or it's just in that plan? How do you imagine that working in California? And where I grew up, eating locally would mean, really eating locally would mean that for 8 months of the year you ate parsnips, potatoes, dairy, and meat, and no produce.
Right.
So how would you generalize this prescription?
Well, you can't generalize the prescription. And in fact, one of the studies I looked at, the only other place that I saw such a cross-sector study was in Michigan. So one of the factors was that produce was scarce during part of the year. So some of that is a cultural shift in terms of the K through 12 school districts, for example, being more open to winter vegetables such as kale and Brussels sprouts that are typically not on the menu. Things like that. In terms of your question on grain, I think that is much more complicated with our drought in the state, and it might be one of the commodities that needs to be shipped in. So that's where the balance has to come. If we can purchase local produce, but some of the grain might have to come from farther away. It's a balance. Okay, I think I'm being kicked off. Thank you very much.